We begin with a shock report on allegations of abuse at the heart of our medical profession. More than a third of NHS surgical staff say they've been sexually assaulted in the last 5 years. It's according to a new report which our correspondent Rachel Venables has been reading about this morning. Rachel, just tell us a little bit more about the facts and figures that have been uncovered in this report.
Well, there are three key findings, I think, that really jump out at you in this report. Number one is just the sheer scale of it. The number of people who work in our surgery teams throughout the NHS who have experienced or witnessed harassment, abuse, even rape is really staggering. Then you've got the difference in the experiences between men and women. The report, which was published in the British Journal of Surgery, basically described them as having different realities, living in different realities. And finally, there's the lack of faith in the systems like the NHS trusts or the General Medical Council, which should be protecting the NHS staff. Now, if I was to run you through some of the figures now, 1,400 people working in surgical teams responded to this survey, online survey to Exeter University. In it, 63% of the women who responded said they had been sexually harassed by a colleague. Now, for men, that was 24%, nearly a quarter of men saying they had been sexually harassed. Then 30% of women saying they had been sexually assaulted, so nearly a third. And that number dropped down to 7% of men reporting to this study that they had been sexually assaulted by a colleague. And lastly, the figures found 11% of women reported having been forced into some sort of physical contact for career opportunities. Now, as you'd expect, there has been a real outcry over this story this morning. It's already being called surgery's Me Too moment. And this was the Science and Tech Secretary, Michelle Donnellan's response to it when you put it to her a little earlier.
This is absolutely a outrageous story, really, I think is the correct word for this. And I would urge anybody, no matter what sector they're in, to come forward if they are a victim of sexual abuse or any type of abuse. I'm sure that the Health Secretary will be paying strong attention to this and will be looking into what more can be done.
And no doubt those NHS bosses will be looking at this very, very closely, this report already on the front page of one of the papers, of course, this morning. And not just for the way the report highlights issues for staff, with in extreme cases, people reporting having been left with self-harm or even contemplating suicide as a result of some of this behaviour, but also because the survey warns about the wider risk to patient safety as well in such a high-risk environment.